What are ADHD rating scales, and how do they help diagnosis? Imagine trying to figure out if someone has attention deficit hyperactivity disorder without a clear test. It's like trying to solve a puzzle with missing pieces. That's where ADHD rating scales come in. These are specially designed questionnaires that help gather important information about symptoms. They focus on core signs like trouble paying attention, hyperactivity, and impulsiveness, which are key parts of the diagnosis process. Rating scales work by asking people to rate how often certain behaviors happen. For example, they might ask if a child or adult often forgets things or fidgets. The person filling out the scale uses numbers, usually from 0 to 3, where 0 means never and 3 means very often. This way, clinicians get a clear picture of how severe the symptoms are. These scales also look at how symptoms affect daily life, like school, work, or relationships. They might ask if someone has trouble making friends or managing tasks. There are two main types of rating scales. Narrowband scales focus only on ADHD symptoms. Examples include the Vanderbilt assessment scales and the Conners scales. These are used for children and adults to see if core symptoms are present. The other type, broadband scales, look at a wider range of behaviors. They check for issues like anxiety or depression that often occur alongside ADHD. They also evaluate how well someone functions in different areas, like school or family life. People who fill out these scales are usually parents, teachers, or the individuals themselves. For children, parents and teachers are the main observers. Older kids and teenagers can complete their own scales. Adults often do a self-report, and sometimes a spouse or close friend can help by giving their perspective. This multi-source approach helps get a full picture of how symptoms show up in different settings. Rating scales are a helpful tool but not a standalone test. They support the diagnosis process by showing whether symptoms are present and how they impact daily life. To diagnose ADHD, clinicians look for positive scores on these scales in more than one setting, like home and school or work. They also check if symptoms have been ongoing for at least 6 months and cause real problems. Getting ready for an assessment means understanding how these scales work. If you're filling one out about yourself or a loved one, be honest and think about specific examples. Having multiple people complete scales provides a more accurate view. Remember, these scales are just one part of a full evaluation. Doctors will also review medical history, conduct interviews, and sometimes do additional tests. All of this helps create a complete picture, guiding the best treatment plan. So, rating scales are like a map. They help navigate the complex process of understanding and diagnosing ADHD.